you have low back pain? Well, we're gonna tell you how to fix it. I'm Dan with KickAt55 Fitness, and today we're talking about how to cure our low back pain and our ailments. Remember to subscribe to our YouTube channel and click on push notifications so you can stay up to date with all our current talks. All right, guys, so there are many reasons that we may be having low back pain, and today we're gonna be talking about the different reasons and what we can do to help alleviate some of the pain or minimize some of the pain. So if you feel like you're sitting too long and you stand up and you have some pain in a backside on one side or maybe even on both, or if you bend over and you pick something up and you get caught or stuck, these are some typical easy movements that we're going to use and teach you today so we can start to help get us back on our rehab journey, back into our normal workout routines. The first and most important thing when it comes to any low back pain, regardless of the mechanism of injury or if it's acute versus chronic, is we need to be we need to be moving. So the idea is if we are not moving, if we have a sedentary lifestyle, we're going to get stiff. Our muscles are going to get shortened, which means they're going to get weaker. That also is going to lengthen certain other muscles, which will make them overactive, which will then inhibit certain postural muscles, which we actually need for our spinal stability and to help with any kind of low back pain. Now, the two things that I find are most important when it comes to helping with any type of low back pain is the first one is going to be core strengthening. We want to be able to strengthen our transverse abdominis, which is the most deep core muscle. We want our rectus abdominis, which is the six-pack muscles you're looking for, the obliques on the side, internal and external, and then the paraspinals and the low back. We also want to be able to stretch our hip flexor muscles. It's going to be very, very important that because we sit most of the day, our hip flexors are going to be shortened, and we're going to have to lengthen them and also strengthen them as well. All right, so we're going to talk about some do's, and then we'll talk about some don'ts on how to fix low back pain. I have my boss and colleague, Rebecca, here to help me out. She's been dealing with some low back pain over the last month or two. So we're going to work with her and show you guys how to be able to do proper strengthening. The first thing we're going to work on is a pelvic tilt. So I'm going to have her lay on her back. Her knees are going to be up. So when your knees are up, it takes some pressure off of your low back. The first and most important thing we have to do is strengthen our deep core muscles, our transverse abdominis, and we do this by a pelvic tilt. So what she's going to do is she's going to try and flatten her back against the table. Yep, just like that. Now, as a therapist, or if you are having trouble figuring it out, what you can do is put your hands under your back and give yourself some cueing. You want to push down into your hands. That will help feel like you are tightening your core muscles. So you want to do this for about 20 reps, maybe 5 to 10 seconds. The more you're able to hold it, the stronger that deep core muscle will be, which will then loosen up the rest of the back muscles. Remember, the transverse abdominis attaches to the spine, so we want to be able to get that mobile. So that's the first one we're going to do. The second one we're going to have her do is a dead bug exercise. So she's going to have her hands and knees up in front of her. So you could go ahead just like that, about 90-90, hands up in front of you just like that. Now, every exercise we want to do core-wise, we have to pelvic tilt first. So don't just start doing a core exercise without keeping your back flat against the ground. So the first thing we cue her for is flatten your back, and then you're going to lower one leg and the opposite arm as you go down. Nice, slow and control. Hold it for a second. Notice if her low back is going to start to arch. That's going to tell us we have tight hip flexors, and it's going to tell us our deep core muscles are a little weak. And then she's going to switch, come back up, and then do the other side. Good. Now, if you're in a basic form and you haven't done much core strengthening, you can come on out of that. You don't want to do too much because you're going to get really, really sore really, really quickly. I would say maybe 5 or 10 just to start for one day, and then you'll build yourself up over the next couple days or next couple weeks. So that's our core strengthening, our base core strengthening. Eventually, we're going to get to the more superficial muscles, the rectus abdominis, the obliques. For now, we want to really just focus on that pelvic tilting, getting our spine to be able to move comfortably with good, deep core strength. The second thing we want to focus on is to stretch our hip flexors. So the two favorite exercises I have are, one is called the end of the bed stretch, or the Thomas stretch. So Rebecca's going to lay on her back. Yep, thank you. She's going to hold on so she doesn't fall off the other side of the table, and she's going to come right to the edge of the table and drop her leg straight off. She will feel a stretch coming right here under that hip bone. Now, if that isn't getting a good enough stretch, what you can do, you can take a rope and you can bend your knee. You're going to feel it a little more lower down into the leg. Personally, I like the one where we're not pulling with the rope because it's going to get more of that iliopsoas instead of that rectus femoris muscle. But both of them are hip flexor muscles, so they both need to be stretched as well. You hold this one for about 30 seconds, and every patient I do this with has always told me this is their favorite stretch. So it's very, very gentle. If you don't have a bed that's high enough, you can go to the end of the bed this way and drop your legs off, kind of like a knee chest exercise. So you can come on back up, and like I said, about 3 sets of 30 seconds to start. You build your way up to about a minute. Also, you can do a pelvic tilt in that position, which will also increase that hip flexibility as well. The second hip flexor stretch you want to do is the classic lunge stretch. So she's going to get into a lunge position, and we want to focus on our angles. What ends up happening is we want a pelvic tilt while we're in a 90-degree angle. So we have 90-degree bend here, 90, and then straight and 90. If we lean forward into our lunge, watch what happens to her back. She's going to arch her back, which is going to put those bones together, which is going to cause more pain. So actually, we want to get her comfortable in that neutral position first, then get the pelvic tilt, and as we lengthen, then we can go deeper into our stretch like that. So same idea, you want to hold this one for about 20, 30 seconds, 3 to 5 times, and you can do this a couple times a day. You're going to start to realize this is really going to help lengthen that lumbar spine, give us a little more space and a little less lordotic curve. So that's kind of what we're looking for. Now, what we're talking about with a lordotic curve, you can come out of that, thank you. When we're talking about lordotic curves, it's coming from an anterior pelvic tilt. And it's super important to understand what anterior pelvic tilt is. Basically what happens is we are sitting 8+ hours a day at work, right? We're looking at our phones all day, so we're looking down. So we have to be able to get you guys out of this flexion-based posture. Most people have forward head, rounded shoulders, and anterior pelvic tilt. So we have to be able to correct those muscles. And what happens with anterior pelvic tilt, our hip flexors are shortened and they're weak, which means our hamstrings are lengthened because where the hamstrings connect is right on the pelvis, and if it's tilted forward, the hamstrings will be on maximum stretch. What that happens is when the hamstrings are on maximum stretch, they become the primary agonist movement of any type of hip extension instead of our glutes. So we have weak and inhibited glute muscles along with a weak and inhibited transverse abdominis, that pelvic tilt core muscle we were talking about. This will come over later on. It's called lower cross syndrome, and it is something vital in the ability to be able to correct our poor posture to help with our low back pain. Okay, so we've talked about a couple of the things that we want to do. Let's talk about one very important thing that we don't want to do. We want to not be in a flexion-based posture mostly throughout our day. So if you're sitting a lot, if you're bending over to pick something up, or anything along those lines where you find that your lumbar spine, your low back is going to be bent over and flexed, we want to be able to get you out of that situation. One of my favorite things I'm going to show you to help combat a flexion bias is the McKenzie method. So the first thing we're going to talk about with McKenzie is we want to get you in the opposite direction of where your body is most comfortable. So you're in flexion most throughout your day. We want to now put you into an extension. So the first thing I'm going to have Rebecca do is lay on her stomach. Now, if you're not comfortable being in extension, I don't want to have you just do press-ups so you start causing aggravation. We're going to start very easily. I'm just going to have her prop herself up on her elbows first. Just like that. Just by sitting in this position, you're already in a lumbar extended position. Now, it's not full lumbar extension, but like I said, if we just go from I'm always in a flex-based position and I start jamming into extension, my muscles will go into spasm, I'll cause myself more pain. Typically what I do with my patients is that I'll have them sit in this position for about a minute. We'll do that 3 times just to get them a little more comfortable being in that extension. After that, once they're a little more comfortable, they've adapted to a new range, what we'll have her do is we'll have her put her hands right underneath her shoulders. She's going to press up while keeping her pelvis down, and when she's in the up position, she's going to exhale and drop her pelvis a little bit more. So you see how we get that full extension. You hold for about 3 to 5 seconds, and then you lower yourself back down. To start, you're just going to do about 10 of these, right? This isn't something that's going to fix you in one day. It's going to take some time. The biggest thing is we get up, we exhale, we drop that pelvis, putting us into full lumbar extension. Inevitably, this will help get you out of that flexion-based posture, and that's what we're looking for. So, in summary, we've given you 5 exercises that we can have you do for your plan. We're going to go over them one more time. The first one is going to be the pelvic tilt. So Rebecca's going to show you again. You're going to have her put her hands right under her. We're going to have her use her core to flatten her hands out, hold for about 10 seconds, and then release. and you can give yourself that arch, and you can start to see, wow, my back is really arched against this table, and I want it to be flat against this table. So we do about 20 to 30 of those a day, holding for about 10 seconds, just like that. Perfect. Next one again, we're going into the dead bug. We're at 90-90, hands are up, pelvic tilt first, lower one. Yep, so that's going to be very important. Someone's going to want to just go right into it and cause that arch in the low back that's going to end up hurting you in the long run. Flatten the back first, then lengthen. Hold for about 3 to 5 seconds to start. You can build yourself up to 10, 20, or 30 seconds. And again, we're just going to start with 10 to 20 of them a day, a couple times a day, and then we're going to build you guys up to maybe 30, 40, or 50 to really get that core strengthening. Good. Excellent. So then we're going to go back to those hip flexor stretches. And, I want you to do them on both sides. One side of your back may be hurting mostly, but we were going to want to stretch both hips out. So you hold onto the bed, you keep this knee bent, and you drop this one off. Now, the more stretch you want, the further you come off the bed, so your hip is hanging off. However, you should be feeling that stretch right here in that hip flexor, right under that hip bone. Again, very, very simply to start, you want to hold about 30 seconds. What we could also do, you see how she now has this arch, she can try and do a pelvic tilt right there, and she's going to feel that increased stretch right in that hip muscle. Remember, we're talking about weak and inhibited versus strong and tight muscles. So that is our third one. Then we're going to want to do our lunge stretch. Like we talked about, angles are very important for this. We don't want to put us into that lumbar extension just yet. So we want to get 90-90 and then just work through our pelvic tilting. Now we're finding a new neutral. And we're teaching our body how to stay in this kind of contracted pelvic neutral position. Later on, as she gets more comfortable, then she can lean more forward into it. But we want to still keep that pelvic tilt. And finally, we go to the Mackenzie. We start propped up on our elbows, get that little bit of a lumbar extension. Now, it's not full range of motion extension, but we just want to start so we don't cause spasm. After this, about 1 minute, 3 times, she does the prone press up. You can call it a scorpion, whatever you like. Big thing is once you get up, you exhale, you drop that pelvis. You're going to do that about 10 to 20 times. And that, ladies and gentlemen, is going to be your acute and quick plan to fix your low back pain. Thank you guys for joining our discussion on how to fix low back pain. Remember to subscribe to our YouTube channel and click push notifications to stay up to date with all our current talks. And if you like this video, go ahead, click the thumbs up button, and you can follow us on Facebook, TikTok, and Instagram. We'll see you next time.
Remember, subscribe to our YouTube channel and click on push notifications so you know when our next workout posts.